Hey, psych students! Well, if you've made it this far, then you've made it to the end of the course, which is Chapter 14, Health Psychology. So this is a newer topic in general psychology, so you will not see any crash courses in this. So we do have the study hall, which is more updated, and we start with the psychology of stress, what is health psychology, and ending with health psychology and chronic disease. So this is a great chapter full of a lot of information, but it's not going to be a lengthy lecture. Do not worry. All right, so we are going to cover health psychology and behavioral medicine, making positive life changes, resources for effective life change toward a healthier mind and body, managing stress, behaving as if your life depends on it, and then ending with psychology and your good life. All right, so looking at health psychology and behavioral medicine, health psychology, what they aim to do is to establish and maintain health, preventing and treating illness. So if you're getting into this field, that is going to be your concentration. You're also going to be focusing on behavioral, social, emotional, motivational, and cognitive factors. I need to make that so that you could see it. All right, behavioral medicine integrates behavioral, social, and biomedical knowledge. Health promotion, optimize health and achieve balance. And then public health, focus on large populations. So I find that many students that are in the nursing program or any of the health and wellness, they generally end up taking health psychology as a course. So it's a really good one to integrate with that field. And then, of course, guide policymakers. All right, so tailored public health messages. So do your part, stay 2 meters apart. Of course, this really was focusing on the COVID-19 pandemic. So you're going to see these newer types of signage. And of course, now that we're moving away from COVID, you're going to see less and less of these types of messages. But now that it has occurred, where you're just more mindful of our health practices. All right, so looking at the biopsychosocial model, health psychology integrates biological, psychological, and social factors in health. So again, we're still going to be combining all three factors. All right, so your mind affects your body and your body affects your mind. So they are very simultaneous and they work together. So anything that I've said this in the beginning of the course, anything biological is simultaneously psychological. So with the mind affects body, so do a lot of other things. Same with the body affects mind, so do a lot of other things. So both are deeply connected and very interwoven. All right, so health psychology and behavioral medicine, how psychological states influence health, how health and illness may influence a person's psychological experience, all go hand in hand with the mind and body. All right, so when we look at some theoretical models of behavioral change, let's first bring up health behaviors. So what are those? If you're thinking about what your own health behaviors are, those are things that you practice that are going to impact your physical well-being. So adopting a healthy approach to stress, exercising, eating right, brushing your teeth, performing breast or testicular exams, not smoking, drinking in moderation, and practicing safe sex. So there might be other things that you may think of that are not mentioned in the text, but these are some of the kind of heavily focused things when we look at health behaviors. All right, so theory of reasoned action. Effective change requires specific intentions about behavior change. So when you're thinking of what you can do specifically, maybe you discuss them, maybe you write them down, you talk with a professional about these things. So you have to have intentions in order to kind of implement these healthy behaviors. It's important to have a positive attitude about the new behavior you're going to adopt. Perceptions of social group support. So everyone has what their perceived notions of help include. So just knowing them. So example, success will be higher if you want to quit smoking, that you devise an explicit intention of quitting, feel good about it, and believe that your friends support you. So that is going to lead to a more realistic expectation of change if you have these things in mind. All right, theory of planned behavior is the same as above. Effective change also requires perceptions of control over the outcome. So you have to have a level that you have control over what it is that you want to change. All right, so how do individuals make healthy lifestyle changes? So there is the stages of change model. We use this a lot when working with people with substance use disorders, or not substance. Yes, substance use disorders, which encompass, that's an umbrella term that could be alcohol, it could be opiates, it could be cannabis, whatever it is. All right, so when we're looking at this on just a healthy lifestyle change, we look at the stages of modeled change. The first one up is the pre-contemplation. So that is the person might not be ready to even think about changing their behavior. So the saying that goes along with it, ignorance is bliss. So hey, if I don't know, it's not real. So that's the pre-contemplation. You're not really even thinking about it. Then we move to the contemplation stage. And that is when you start acknowledging that there is a problem. So you might be what they call sitting on the fence. You're like, okay, I know there's a problem. I don't know. I'm kind of deciding whether I think it's a big enough issue, right? And then we have the preparation or determination stage. And that's plan action, explore options. This is where we call it testing the waters, where it's like, okay, well, maybe I'll decide to do this or that. So you can just kind of think about in your own mind what that behavior change might be for you. Then we have the action stage or willpower. This is now when you're going to commit and enact a plan, whatever that plan is. So whether it's adopting a healthy lifestyle, dieting, exercising, changing something. This is now you're like, okay, I'm not testing the waters anymore. I'm not sitting on that fence. I am actually going to do this. And then we have what's the maintenance phase, and we do that in therapy as well, and that is the goal for long-term success. And the major part here is we're going to avoid relapsing, whatever that change is. And trust me, there are a bazillion different changes, so this is kind of that model that you want to go by. Relapse is common, but slips do not equal failure. So I know that with my own clients, they feel like if they lapse, if they have went weeks, months, or even years being sober, and then they have a lapse, that is not a relapse. So if an anniversary comes up or just something happens and they use a substance or whatever, often they can feel like they're starting over, that they're a failure, whatever. So that is where I come in and I help them see what is fact from fiction and discussing that that is not a failure at all. Relapse is when it is a pattern. So not only is it one time, it might be multiple times, or it might be, just kind of going back to the same behaviors. Now, again, it does not mean it's a failure, right? Things happen in life. So it just means that we have to get back up on the horse and anything you've learned, right? You can unlearn. So it's if you've gone a long time without, doing something, you can go back and you can do that again. All right, so resources for effective life change, personal motivation. We've got the self-determination that we discussed in a previous chapter. Intrinsic versus extrinsic motivation. So what motivates you? Are you motivated from within, intrinsic, I'm doing it just because for me? Or are there some external factors, which is extrinsic? I'm getting something out of it, some type of external reward for doing this. Implementation intentions are specific strategies for dealing with the challenges of making a life change. So why do we do the things we shouldn't do? That is something that is a very personal question to really ponder or reflect on. So why do we do the things that we shouldn't do? Instead of asking the why, I often say this to my counseling students, let's explore the what. What is it that causes me to make these decisions? Is it self-sabotage? Is it I'm starting to become proud of myself, so I'm getting afraid? Fear is a big one, fear, shame. So it's a good, again, good question to ponder. All right, social relationships. So resources for effective life change, offering social support, tangible assistance. Those are those things that we can hold on to. So family and friends. Information, recommending specific strategies, emotional support, offering reassurance, social sharing, turning to others as a sounding board. Giving support also has benefits. So giving back, obviously giving back to anything is going to boost your resilience and make you feel better about your own sense of self. And then religious faith, if you want to look more into that, that is on page 544 of your text. That is also linked to healthier behaviors. It's also linked to living longer and having a healthier life, obviously long term. All right, personality characteristics associated with positive health behaviors. Conscientiousness. That is something we discussed in the personality chapter. So, most important trait of the Big Five personality inventory, taking responsibility for life events and having that internal locus of control where you feel that you are in control of your life events to the best, of your ability. Best of your ability. Self-efficacy, believing you can master a situation, whatever that is. That doesn't mean you're perfecting anything. It just means that whatever, situation comes my way, I'm going to master it to the best of my ability. Having that optimism, being proactive with a positive mindset. That doesn't mean that you're just going to always think positive and you're going to sweep all the negativity under the rug. No, it just means that I am going to have an optimistic mindset where I'm going to be proactive in whatever negative event might come my way, rather than looking at it from a pessimistic lens that no matter what I do, it's not going to be a good outcome. So optimism is looking at that way. It's not like a false sense of oh, everything is great in the world. These qualities can be cultivated, but not everything that happens is under our control. So there are situations where if there's a medical diagnosis and we know that nothing we do is going to change that, it is important to have that realistic expectation, but we still can show optimism in the things that we can't control. Is it easy? Absolutely not. But these are things that we can work towards doing. All right, stress and its stages. General adaptation syndrome, also known as GAS, common effects of stressful demands on the body. We have 3 stages. We have the alarm stage. The body mobilizes its resources. We've got the resistance stage. The body strives mightily to endure the stressor. Your body is just like, I need to get through this. And then we have the exhaustion stage. Resistance becomes depleted because you've used all of that resistance, right, to kind of endure that stressor. When you get to the end of it, you're just depleted and you have to get back to that balance, that normalcy. All right, so what parts of the brain are impacted with this stress? We've got the hypothalamic pituitary adrenal axis. So controls reaction to stressful events. So this is the area in your brain that is responsible for that. Corticotropin. Oh, this, I gotta say this slowly. Corticotropin releasing hormone, which is cortisol. That is important when we're talking about stress. Acute stress, sometimes we go through acute stress that can be adaptive with release of cortisol, helping us take action. So when we do have that acute stress, it can help us get through situations, right? There is what's called eustress. I covered that earlier, and that is a positive stress. It keeps us like on our toes and remaining to where we can keep adapting to stress. But then there's chronic stress. That's the negative stress. HPA axis activated for an extended period. When we have chronic stress, that lowers our ability to regenerate quicker. So it's important to know the difference between the two. All right, so more impact. Psychoneuroimmunology explores connections among psychological factors, nervous system, and immune system. So stress can profoundly affect our immune system. Not only can affect it, it can exacerbate cancer. So if you're going through cancer or relapse or anything like that, when we put stress on our bodies, it can exacerbate it. It doesn't necessarily cause it. So, some people think that stress causes cancer. It doesn't exactly cause it, but it can definitely expand on it. I feel like, let me go back. Oops. All right. So stress can profoundly affect immune system. Effects of acute stressors versus chronic stressors. It's important to know the difference of those effects. Acute stressors, sudden, stressful, one-time life events can produce immunological changes, but are generally not problematic. So maybe think of an experience or a time in your life where you went through an acute stressor. And then we have our chronic stressors. Those are longer lasting. They're associated with increasing downturn in immune system responsiveness. So maybe there are also situations in your life that are chronic. So you can just pause and think about things in your own life that have been acute or maybe chronic. And not everybody has gone through chronic stressors. All right, this is just a chart showing you the duration of life stressors when we're looking at stress and the risk of developing a cold. All right, cardiovascular disease, chronic emotional stress, death of a loved one, loss of a job, natural disaster, and there's a myriad of other things. So this impact of stress can really affect our cardiovascular health. Major life changes increase risk. Impacts of type A, type B, and type D personalities. In earlier texts, we discussed type C personality, which is kind of like a combination. But now we talk about what's called type D personalities. Internal reactions to stress do not lead directly to poor health. How people behave when they are stressed is a factor. And we've talked about this before, about the different personality types. So the type A are those more stringent, rule, orderly, have to have everything like in place. Your type B is your more laid back personality type. They're just kind of go with the flow. All right, so when we talk about cancer and stress, chronic stress may damage the body's capacity to resist cancer and may promote tumor growth. So again, as I said earlier, it doesn't cause it, but having that chronic stress can make your body have the inability to kind of resist that, the fight. All right, so now let's look at type A, B, and D now. So your type A being excessively competitive, hard-driven, impatient, and hostile, higher incidence of heart disease with this type of personality. Your type B, like I said before, being relaxed, easygoing, lower incidence of heart disease. Your type D being generally distressed, having negative emotions, and being socially inhibited, related to adverse cardiovascular outcomes. All right, now let's touch on stress and prejudice. Stigma attached to various identities leads to stress when we talk about race, ethnicity, sexual minority status, immigrant status, veteran status, overweight and obesity status. So these things can create this stigma. So it's just important to be mindful of this and, get a little more educated on it. And those videos that I posted should help. And again, I highly recommend taking a health psychology course if you're entertaining this kind of field of study. All right, health disparities, often preventable differences in physical and psychological functioning experienced by socially disadvantaged groups. Discrimination affects stress response and immune system functioning. I mean, just think about that. I mean, it's not rocket science, right? Why that would be a thing. All right, coping with stress, looking at the cognitive appraisal. So again, cognition is thinking. Primary appraisal, personal interpretation of event as harmful, threat, or challenge. So when we're looking at that primary appraisal, we're looking at your own interpretation. Secondary is evaluation of coping resources. When we look at emotion-focused versus problem-focused coping, emotion-focused, right? Coping strategy that involves responding to the stress and trying to manage the emotional reaction rather than focusing on the problem itself. When we look at problem focused, coping strategy of facing the trouble and trying to solve the problem. So which one do you think might be more challenging or more associated with stress? All right, positive reappraisal and optimism, reinterpreting a potentially stressful experience as positive, valuable, or even beneficial. And in therapy, that is the kind of technique we use with clients, is to get them to reframe their thoughts. So reframing that once negative look, we look at reappraising that by reframing it. All right, hardiness. That is a personality trait. That's its own little, we've got type A, type B, type C, and then we have what's called hardiness. Sense of commitment and of control, not out of control, but sense of commitment and of control rather than alienation or feeling powerless. It's a really good personality trait to have. Perceives problems as challenges, not threats. So again, when you look at your own personality trait and we look at A, B, C, D in hardiness, think of where you fall in. And if you fall into one of those more concerning ones, you can, through therapy, work on that to gain this hardiness personality trait. All right, stress management programs teaches individuals how to appraise stressful events, how to develop skills for coping with stress, and how to put these skills into use. Right, so towards a healthier body and mind, be physically active, exercise, structured activities whose goal is to improve health. Whatever that looks like for you. I would not do hey, it's January 1st, we're going to start off the new year. Start now. I remember when I started, it was October 1st. I was like, you know what? There's nothing between October and December that's going to change my perception of getting healthier. We trick ourselves into thinking, okay, we've got to have this New Year's resolution. When we set ourselves up for this big giant goal, that's when it all kind of implodes. So it's important to have a very realistic expectation. So we don't want to I'm going to go in and I'm going to work out 5 days a week. No, maybe start off 1 or 2 and build up and get to a point where we say, okay, our body also needs rest. So I'm not going to build up to 7 days a week. I might build up to 4 days a week or maybe 5 days and take the weekends off. So whatever works for you, we need to have a realistic goal. When we look at the aerobic exercise, sustained activity. So it's sustained. It's they say the average, what's really healthy is at least 30 minutes a day. So we don't want to over exert ourselves. So when you are doing aerobic activity, you want to do at least 30 minutes a day. That's the guideline. So jogging, swimming, walking, cycling, whatever, that stimulates your heart and lung functioning. You want to build it up. All right, more towards the healthy body and mind. Eat right, whatever that looks like for you. Quit tobacco use. Again, when they say quit tobacco or quit whatever, we want to make sure it's right for us. So there are psychological therapy modalities we use instead of just, we don't quit cold turkey. That is kind of dangerous because it can also have you start doing that whatever again. So, instead of the pack a day, right? It might be, okay, well, now I'm going to go to 3/4 of a pack, and then I'm going to go to half a pack, right? And then I'm going to go to, and so on. And then it might be, well, I'm going to take this gum, right? Or medication that helps me quit. We want to make sure that what we're doing in that aspect is slow. It's a slow process. We want to think narrowly on that. And I tell my clients, like, yes, I'm very narrow-minded when it comes to that. We don't want it to be broad and just like, ooh, quit. We want to go step by step, just like a baby had to like be held and then lift their head up and then crawl and walk and all that stuff. Same thing when we're taking care of ourselves. Practicing safe sex is obviously very important as well. All right. Making the most of what you have learned about psychology means making the most of yourself and your life. So it's really important when you're sitting back and you're assessing everything, your health, your wellness, all that journey, it's important to really understand, what does this mean for me and what does this mean for the rest of my life and my journey with myself and the people that I allow in my life. So hopefully you have enjoyed that. I kept it under 30 minutes. I knew that there wasn't a lot, but I knew that what it was really in depth. So I definitely wanted to cover that. So hope from wherever you're watching that you enjoyed the lecture and you got a little more out of this. And again, if you are really thinking about the health and wellness track, or going into any type of medical field or nursing or anything like that, this is a really good course to take, a semester in health psychology or minoring in psychology alone. So, all right. Hope you enjoy the rest of your day, evening, wherever you are at. And thank you for taking this journey with me through general psychology. I truly hope that you have enjoyed all 14 chapters, or at least the majority of them. Some I might give or take. But anyways, it was a pleasure, and hopefully I see you out there maybe somewhere in the world. So, namaste. Have a wonderful, wonderful journey in your life. All right, peace.